Welcome to the Hampshire Hospital's annual general meeting for 1923-24. Have I got that right? So welcome to you all. My name's Steve Erskine, I'm chairman of the trust, and unfortunately for all of you, I'm the host for this evening as well. So what could go wrong? Welcome all to also our people on virtually. If you could all turn around and just wave at the camera, we can wave at the people who are joining us online. Thank you very much. Indeed. And one piece that I just need to tell you, there is no planned fire alarm this evening. So if the fire alarm goes off, we do need to vacate. Okay. Thank you. Is that right? So would you like me to do that then? Yeah, okay. Sorry, a little bit of logistics going on there. I didn't think it would go wrong on the first slide, but there you go. What's really nice, isn't it, is to be able to do this face-to-face. And it's nice to have so many people in the room. It's nice to have people join us virtually. And I just want to say, and you'll hear this said a few times this evening, but I just wanted to say to all of our staff, to you, to our patients, to our communities, to our governors, to our board members, just thank you for the amazing support you've given the Trust over the last year. And if we can just remember, it's really hard with AGMs because you hold them in September, but you're talking about the year that ended in March and went back to last year. So when we say this year, we're actually talking about the last year. And when Alex talks about the future, we're actually talking about from March on rather than where we are now. So just bear that in mind that we're talking about the previous year. And the AGM is our opportunity to talk to you about what we've achieved, what our challenges have been, and it gives you an opportunity to talk to us. So throughout the evening, we will build in several opportunities for questions and answers from anyone in the audience and anything that you want to ask. So a quick look at the agenda. That's me at the top there. Alex is going to come up and do a review of the year. We'll get a financial update from Steve, who's our Chief Finance Officer. Alex is going to do a bit of a look ahead to the next year. We'll get some remarks from our lead governor, Dawn, who's with us here this evening. And then, really, really importantly, Claire and her team will be giving us a clinical presentation about reducing waiting lists, because that's something that I know touches on a lot of people in our communities. The Q&As, as I've said, we'll build into the evening. If you're online and watching virtually, you can put your questions in the chat, and we will then pick them up as part of the Q&A. You don't have to wait to the Q&A, just put them in the chat now, and we'll pick them up as part of the Q&A. Annual general meeting, so there's a couple of formalities that are associated with the AGM. So there's a copy of the Trust annual report and annual accounts on our website, and I think there are a few hard copies around as well, which you can take away with you. This is our opportunity to formally present the annual report to you. It talks about governance, it talks about structures, performance of the organisation, review of the year, and it talks about our accounts and our financial position. So that's what's in the annual report, and that's formally what the AGM is to do. We've also made a few minor amendments to our constitution during the year that reflects best practice, it reflects changes to the national position, and it brings us in line actually with the NHS model constitution. These have been approved and registered with NHS England, and you can find them on our website. So it's just to notify you as part of the AGM that there have been minor changes to our constitution, and we need to tell you that. Nothing significant in there that you would need potentially to worry about. Now, I've just passed the first test because I've touched the computer and it hasn't stopped working. So that's always good news. So I'm going to hand you over to Alex, but just before I do, I just want to say a few thank you to people. Number one, and probably most importantly, I wanted to say thank you as chair of the trust to our brilliant, brilliant staff. The fantastic job that they did throughout the year, the fantastic job that they do under all sorts of challenges and under all sorts of pressures. These are special, special people, and it's a privilege to actually work with staff. And for all of you in the room who are staff members, thank you for everything that you've done over the year. I also want to thank our volunteers. I did some in your shoes work a couple of weeks ago when I went out and shadowed a couple of our volunteers. And what a fantastic job those people do, Jane, don't they? Supporting our staff, doing some of those things that are nice to have, things that actually make such a difference to patients. And I shadowed a volunteer in the emergency department who was working with a lady who had dementia, and he was making such a difference to that patient journey. And of course, I want to thank our governors, because quite rightly, what our governors do is they hold us to account to make sure that we do the right things as a trust. And just as importantly, what they do is bring the voice of the patient and the communities they serve into the meetings as well. So I want to thank them for their dedication, commitment, and making sure that we still provide the quality of care that we always aspire to our patients. That's enough from me. I'm going to hand you over to Alex, and she's going to do the review of the year.
Steve. Thank you. Lovely to see people here this evening. So, before we get into what we were up to in 23-24, we're going to just describe a little bit about Hampshire Hospitals for anybody that perhaps doesn't know quite what we do. I'm Alex Whitfield, I'm Chief Executive, and it is my absolute privilege to be part of this incredible endeavour that provides care to a population of around 600,000 people who live roughly in this purple area, from Newbury down to Eastleigh, from Andover across to Alton. We do that from our 3 hospital sites in Basingstoke, Winchester and Andover, but we also provide loads of care in community settings, in GP surgeries, in places like Alton Community Hospital, where I was last week, in people's own homes through some of our community teams, community midwifery, community children's teams, and a whole variety of others. So that's the people we look after, and that's where we always start. Who are we here to serve and care for? Who are we? We're around 8,500 people, slightly more than that, depending on how you count them, if we include our volunteers, our wonderful volunteers that Steve mentioned. And we work in partnership with other providers, with Southern Health, who are our local community provider, with our GPs, with our local councils, with the other acute hospitals in Southampton and Portsmouth and the island, with our commissioners at the Integrated Care Board and NHS England, and a whole variety of other people. So we aren't just the Hampshire Hospitals team, we are a much, much bigger team. And our Council of Governors are really important parts of that, and it's brilliant that Dawn's going to come and talk to you at some point this evening. They work alongside the Board of Directors to ensure that all of our community and staff have a voice in our decisions, in our priorities, in our strategy. We've got 25 governors, 15 of them are elected by the public, by members, 5 by staff, and 5 are appointments. If you're not yet a member, I'm hoping many of you in this room are, but if you're not, you can become a member through the website. It's very easy. I always say it's one of the cheapest memberships, doesn't cost you a penny. We don't inundate you with emails, but we do send you some updates about what we're doing, and hopefully it's a really nice balance. And it gives you a voice to elect governors, to have a say in what we're doing here at the hospitals. Our strategy we refreshed a couple of years ago now, 2022 to 2028. Our vision is to provide outstanding care for every patient. And when we think about that, we think about the patients who need our care today, but also those who will need it next year, those on our waiting lists, those who will need it in 10, 20 years' time. And are the decisions we make today benefiting the patients to come? Our values, I'm going to say a bit more about on the next slide. Our strategic themes, we have 5 strategic themes. The review of the year is grouped under those 5 themes. The first is about outstanding care, then about making the trust a great place to work for our amazing staff, then working together for our population, then making the best use of our resources, and finally innovating for a sustainable future. And it was brilliant to see our sustainability team out at the stalls. I don't know if anyone played the bananas game. I was a bit disastrous when I played it with Miranda earlier, but so really, really important. But that's not just about sustainability from an environmental point of view. That's about innovating to provide healthcare that will still be here to look after people in decades to come. So that's our strategy in a simple triangle. And the values section of it is these 5 values. And what we say is everything we do needs to demonstrate these values in how we work with one another, how we look after our patients, how we work with our partners across the system. It's about being inclusive, compassionate, accountable, respectful, and encouraging. And hopefully you will see loads of that this evening. The review of the year we've done slightly differently this year. So I'm going to press it once. Andrew told me if I pressed it once it would be all right. So rather than hear from me, which usually I witter on for ages about all the brilliant things we've done, you will hear from me because I've narrated the video that we're about to play. But you will also hear from quite a few of our teams and even our patients about the things they are proud of in the year 23-24. So it's a bit of an experiment. Do tell us afterwards if you like it, but it felt like it was a better, more inclusive way, more aligned to our values, to share some of the fabulous work that's been going on over the year that finished in March. So I'm going to play the video. To give you a perspective, it's about 20 minutes. So, hello, I'm Alex Whitfield, Chief Executive of Hampshire Hospitals, and it's my privilege to share with you our review of 2023-24. For all of us us here at Hampshire Hospitals, 23-24 was a year that saw many achievements and successes, alongside a number of challenges. As always, we have worked together in our shared ambition to provide outstanding care for every patient who's needed our services. Our people and patients are at the heart of everything we do, and I'm so proud of our colleagues who work with dedication to deliver safe, compassionate, high-quality care. Our iCare values guide our behaviours and decisions. Every day we see fantastic examples of colleagues delivering inclusive, respectful, compassionate care with absolute professionalism. Throughout 23-24, we have progressed our 5 strategic priorities: providing outstanding care for every patient, making our trust a great place to work for our people, working together for our population, making the best use of our resources, and innovating for a sustainable future. As part of this, we've had a real focus on reducing waiting times for both planned surgery and for emergency care, and on making sure people can return home to their loved ones as soon as they are able. Despite the pressures and challenges of the year, we have continued to prioritise providing the right care in the right place at the right time, meeting the individual needs of patients and making sure our care is safe. We're proud of our work around valuing patient time, focusing on what can be done to keep patients well whilst they're in our hospitals, and reducing unnecessary delays to their hospital stay.
Patient flow is very important because if patients don't move through the system effectively, then it means that patients are unable to come into the system.
We know that there's a mismatch in capacity and demand for our acute and emergency services. We know that we struggle to get patients out of hospital to be cared for in the right place, and those things combined mean that sometimes we're unable to move patients through the system in the way that it's designed.
So what we have done is we do 3 times a day safety huddles where we discuss who's here and who needs to not be here and what we need to do to get them out and moving. My night team, they have put a process in place where they do their SATs. Anybody who's going to need some additional care leaving the building, they prep everything overnight. So in the mornings when we get the go-ahead, we tick the button and off it goes. And for that, we've really managed to get ahead of a lot of other areas. And getting SATs done in a really timely manner is fantastic for getting patients through the system and home quicker.
There are numerous stories of teams providing safe, effective and personalised care to help people return home and avoiding hospital admission.
My name's Fergus and I'm currently a patient at HSFT, but more now as an outpatient rather than inpatient. I have a genetic condition, osteoarthritis, which actually know now started in my 20s. So my relationship here has been brilliant because they've been going through each test, scan, x-ray to discount a whole range of issues, and that is what good medical and clinical care is, and get us to a position where we are today, and which is very recent, about what's the way forward. But a long-term condition means you interact with, it could be surgical, it could be physiotherapy, it could be radiotherapy, it could be scans, inpatient, outpatient. It's really, so you have this global view about what works and what isn't working very well in the system. I've got a kind of net of support around me. The quality of the medical care, the empathy, the professionalism of my journey, and I'm still along that journey, and an LTC is a non-stop journey, has left me, when I talk about net of care, an extraordinary reassurance that finally I've been listened to. The overall sense of how do staff in the NHS do this, whatever this is, and to do this right now in terms of what's happening. And I don't know how to thank you.
In line with our clinical strategy, we have continued to co-design our services with our patients, carers and public, listening to what matters to them most and using our quality improvement methodology to improve our services.
Hampshire Hospital's been through a real journey when it comes to working with patients and the people who use our services. There's been pockets of great work, for a long time. There's some really great examples. But what has happened over the last few months and the last year is there's been a lot more centralised approach to the way that we involve people. The people who are using our services are the ones that are really experiencing it and are really the experts in that and the experts in the context. As professionals, we really understand the processes. We have real expertise in what happens and the bigger picture, but without working alongside our patients who are receiving that service and experience it, we don't know really what's working and what's not. We've been working closely with the QI team to develop a co-production in QI Masterclass. This has been a true example of co-production in practice. We started from essentially a blank piece of paper and we've been working in partnership with a group of patients to design a full day training session.
This group is very much wanting to hear how we experience the organisation, the processes within that organisation, the departments. So they very much invite us to be involved in any little projects, even if it's just an idea. Tell us what you think. So this session, we've very much been part of creating a quality improvement co-production workshop. Actually, real patients, real caregivers will be helping to deliver that session, talking to staff, encouraging them to come and work with us.
We've worked hard on improving our maternity services, and in December 2023, we met the criteria for exiting the Maternity Safety Support Programme. We are proud of our recruitment programme for midwifery, with our maternity units safely staffed and a full suite of policies and procedures in place governing the management of equipment, communication and training. Safe and high quality care is incredibly important, and we are continuing to work with families using our services to develop this care even further. As part of our commitment to providing outstanding care for every patient, we've transformed facilities and looked at how we can deliver services in a different way, including through centralisation. In December 2023, we officially opened our new state-of-the-art cardiac facility at our Basingstoke site, the Hampshire Hospital's Heart Centre. It features 2 cardiac catheterisation labs, offering a purpose-built environment for our specialist teams of staff to undertake diagnostic assessment and cardiac procedures. In the first year of opening, staff within our Heart Centre treated more than 2,700 patients, including over 200 emergency procedures.
It's just like walking into a Star Wars set. I thought, what, who, what, where, I was mesmerised. I ain't got words for it, to be honest. No, I haven't. I just didn't know what I was going into. When I saw it all, wow. Then when you're up on the machine led there, you're looking at yourself inside, you think, that ain't me.
The people who work at the heart of Hampshire hospitals are our strongest asset. A highly motivated and engaged workforce has a positive impact on patient care and outcomes. A key priority for us has continued to be making our trust a great place to work for all our people. We continue to develop a strong values-based culture that places people at the heart of all we do, where everyone belongs and where learning, improvement and excellence thrive. Our 2023 NHS staff survey results provided us with valuable insight into people's experiences of working at Hampshire hospitals. This year, we improved or matched scores in 8 of the 9 theme areas, with compassion and inclusivity the highest scoring theme. However, the results told us that there is still more to do. We have seen lower results in some areas compared to last year, and in particular on questions relating to the "we each have a voice that counts" theme. It is vital that all colleagues feel safe and confident to speak up and express their concerns, knowing that we will take the time to really listen, understand, and take appropriate action. The well-being of our staff is an area we've continued to develop and prioritise, and this year we have developed dedicated financial well-being support, menopause tools and adjustments, and mental health assistance, as well as significant investment, thanks to charity funds, in improved rest and break areas, both indoor and out, to enable better rest and recuperation for staff working on our sites. The diversity of our workforce is something we are proud to celebrate. We strive to create an inclusive culture where everyone counts. To amplify and hear the voices of our workforce, it is vital that we provide inclusive and effective channels of communication and learning. We take pride in our staff networks, which support our colleagues, ensuring everyone feels empowered to contribute to the way we run our hospitals and deliver services. During the year, we launched the Neurodivergent Staff and Patients Network.
It started off by an ambition to create a place for people to talk about neurodiversity, a safe place. And like I say, if you think about, we've got over 8,000 staff in the trust, and if 1 in 7 is in the neurodiversity umbrella, when and how can they safely talk about this? I think first of all was to give that safe environment for the staff to talk about it, but also because we know that our patients and their carers, family or loved ones, is writing to us or telling us that we don't get it right all of the time.
The Neurodivergent network offers us the ability to be able to share things at a wider level with people that either live with neurodiversity or allies and want to understand more, and how they can change practice or support people that live with neurodiversity. So I suppose the ultimate aim is that we kind of celebrate the staff that we do have that live with neurodiversity, and it's not a taboo, and people feel comfortable to declare the neurodiversity, so we can support them in the best possible ways, and make sure that we can support them to achieve what they want to achieve. And from a patient care perspective, I think that understanding what their needs are and meeting their needs and improving care and living to those like eye care values, but to make sure that they leave hospital in a far better position than they came to us in.
I think for me the most important criteria to remember when you talk about neurodiversity is it's not something that's broken, it's not something that needs to be fixed, it's not something that needs to be cured, it's just different.
Recognising and rewarding colleagues for the work they do is important to us, and we've done this over a number of ways this year. In March, we held our first People Awards ceremony to celebrate and recognise the incredible contributions of our staff and the difference they make. We were delighted to see nearly 400 colleagues nominated by patients, families and other staff members. In June, we celebrated Culture Week and continued to develop our cultural ambition statement. In October, we held our Staff Focus Week to show appreciation to our staff through distributing over 12,000 gifts and goodies, as well as hosting a number of fun activities. We are committed to recruiting the right people with the right skills doing the right job, retaining and developing people to work in satisfying and fulfilling roles. Throughout the past year, we've successfully welcomed new international nurses, including trained nurses from Nepal, as part of a pilot initiative between the Government of Nepal and the Government of the United Kingdom.
Hello, my name is Alpana Adhikari. I belong to a developing country, Nepal. I have recently come to the UK 5 months ago in February 26. In my ward, respiratory E3 ward, staffs are very cooperative there. The main thing is they are always very keen to help us, and they are never irritated however how much questions we raise to them. So that has made me a lot easier to settle in my ward. I have learned many things in my ward because of maybe because of our matron, maybe because of our senior staffs there. They are very keen to teach me the things very fast. So technique and skills that we have been learned about nursing in our country is totally different here, because though the base is same in all the world, but the technique we used in our country is different than the technique being used here. Even the equipments that has been used in our country is different here, so that has been a trouble for me as well, but I'm slowly being used to it, and because I have good colleagues in my ward.
During the year, 260 colleagues have been developing through 46 different clinical and non-clinical apprenticeship programmes. 91 apprentices have successfully achieved their apprenticeship this year, including 28 new nurse registrations.
I sort of got into this role as I left college and I wasn't really sure what to do, but I knew I wanted to work in healthcare somewhere. So I was looking online, and that's when I found the apprenticeship healthcare support worker role. So I applied for that and luckily got that, and it was sort of like the first stepping stone as in my career. In a standard day of mine, I mean, it's good because where I work in the outpatient department, I obviously work closely with a lot of doctors and consultants, and which are all made aware that I am on the apprenticeship scheme, which is really useful because they're really informative, and actually because they know that you're learning as well. Say I'm in helping with them with a patient, they'll go through and explain exactly what they're doing, procedures that they're doing. When I assist, they explain what they're looking for and looking at. So kind of teaching me as well because they know I'm learning as well. So they're really, really helpful and supportive. When I started here, I didn't really know what I wanted to do, but actually being on the apprenticeship scheme and learning all the different things that I have has actually really inspired me to want to do my nursing as well. So that's how, yeah, and then I can do my nursing hopefully and become a nurse one day.
Together with our partners, we've progressed some important projects and programmes that no one organisation could do alone. Across Mid and North Hampshire Integrated Care Partnership, we've continued our focus on supporting patients at home.
Call Before Convey is a system whereby paramedics with patients at home have the opportunity to call into our hospital and have a multidisciplinary discussion with the specialties who work here about where is best to care for a patient. Also, community providers are involved, so we can see if we can find the best urgent care pathways for patients, and that may not be coming to the emergency department. For example, we had a patient who sadly had lung cancer and had reaccumulating fluid around the lung, and that patient would usually come to hospital in the ambulance, be admitted to the medical team and then have a respiratory review once in the hospital. Through this process, the ambulance team were able to speak to the respiratory clinician in the hospital, and we were able to book that patient in for a clinic the next day to have the fluid drained rather than coming into hospital overnight to wait for that. And it was a great outcome, not only for the patient, most importantly, but also in terms of other system resource in the hospital. The exciting thing about Call Before Convey is that it's a collaboration between Hampshire Hospitals, Southern Health and South Central Ambulance Service. So we really enjoyed working together to get the best benefits for our patients across the system.
We further strengthened our partnership with the University of Winchester. We've continued to work together in a unique partnership to pursue charitable health training, education and research in hospitals in low to middle income countries as part of our collaborative global health hub. This brings together academics and clinicians to facilitate both new projects to grow and existing projects to flourish. Alongside the rest of the NHS, we continue to face substantial financial challenges. It has continued to be important that we spend our money wisely and with best value. Some of the programmes implemented have included delivering services in a different way, often looking at productivity, some centred around increasing income into the trust, and some focused on innovation and transformation. We have increased our day case rate, meaning that we can do more surgery for more patients, not limited by overnight bed stays. This year we began opening services at our new Andover Community Diagnostic Centre. These new and expanded facilities are being created from an £8 million investment to expand community diagnostic services, providing state-of-the-art equipment, a modernised hospital, and reducing the need for local people to travel to Basingstoke or Winchester hospitals for care. In March 2024, plans for our new elective hub at our Winchester site passed their final approval stage, enabling works to begin.
So this is a new facility that's funded by NHS England, and it's an ICB collaborative provided more elective capacity for our orthopaedic services in Hampshire. And essentially what it is a 2-theatre facility with a ward, providing a new way of doing things with our primary joint replacements. This is hips and knees, for which we've had a massive waiting list since COVID, and we've been struggling to recover from the backlog. And what we're hoping to do is to provide ring-fence facilities where we can guarantee that we can get patients through and improve our waiting lists, but also do this in a new way using up-to-date techniques and really provide the best possible care for our patients. Personally, I really wanted to get involved in this because I've been working all my career in theatres that have been up and running for decades, and this is a great opportunity to be involved in a project where we are designing the theatres and the whole facilities ourselves. We can completely rethink the way we're doing things, patient flow. It's really exciting being part of a project where we have a say in how things are going to work. So if all goes according to plan, we should have the orthopaedic hub opening in June of next year, of 25, and we're hoping that the outpatient facility will be opening in October of next year.
Our work to reduce our environmental impact picked up pace during the year. A key priority for us is embedding sustainability across the Trust. To help with this, during 23-24, we published our sustainability and net zero policy and ran our first Green Team competition with the Centre for Sustainable Healthcare. The projects submitted from across the Trust demonstrated a combined carbon saving of just over 252,000 kilograms of carbon dioxide and projected financial savings of over £400,000 per year, as well as benefits to patient care, patient flow and staff experience. We were delighted that 3 of our teams won awards in the National 2023 NHS Sustainability Partnership Awards for their sustainability-related projects. There's been significant progress made in digital. We pride ourselves in being an organisation that actively seeks opportunities for growth and adaptation. I'm delighted that this year we joined the Radiology Consortium, which means clinicians at Hampshire hospitals can now view scans taken in Portsmouth, the Isle of Wight, Southampton and Salisbury, and vice versa. This significantly improves patient care for patients that receive treatment in different hospitals, and it is more efficient, reducing duplication and wasted visits. We were thrilled to reach an important milestone in our work with partners to improve hospitals and healthcare services under our Hampshire Together programme, as we went out to consultation with the public. Over the 14 weeks of consultation, we spoke with people from the communities we serve, patients and staff about the proposals. This was an exciting and positive step in our journey to improving hospitals and the quality and sustainability of hospital services for the future. There is so much more I could have told you about, and please do look at our annual report, which has more detail and more examples of the great work my colleagues at Hampshire Hospitals are driving forward. As we look to the future, we can assure you that we will continue working together with colleagues, volunteers, patients and partners for the benefit of our communities. Thank you. For anyone that doesn't like looking at themselves on television, I can tell you when it's that big, it really is quite horrendous. So, yes, thank you. Right, so that is, you have heard from lots of our colleagues about the brilliant stuff that was going on in the year 23-24. It is an important part of our AGM that you hear from our Chief Financial Officer about our finances and some of the key numbers and pound notes that we delivered or not in the year that finished in March. So, Steve, would you like to come up and just share a little bit about the finances?
Good evening, everyone. I think Alex gave quite a good introduction to this in her video, in saying that the financial position is challenging, I think was the word that you used, and I think that's certainly right. As you can see on the slide here, you know, our reported position in our accounts before impairment charges was a £1.7 million deficit, which sounds not too bad. I think when you look at the underlying position against control total, 27.1 million, That's excluding deficit support funds that we received in March from NHS England. So that's our underlying position. It was in line with our plan, but clearly 27.1 million is still a substantial deficit. And it was a slight improvement on the previous year. Previous year was a 27.7 million deficit. So that's positive. I think what that relatively modest improvement doesn't show is actually the pressures that we had in the year. So, for example, funding reductions and significant increases of almost 7% in our non-elective patients. Of non-elective patients, we get paid on a block. So the more patients that come through the door, we don't get more money for those patients. We get the same amount of money, but we're treating more patients. And there was quite a bit of inflation cost that wasn't met through additional funding either. And if you add all of that up, it was around about £20 million of pressure. So we've absorbed all of that. So we think that the 27.1 million, whilst it's a significant deficit, does represent good progress. And not all trusts manage to hit their financial plans, as we know. As Alex said, a lot of the schemes that we used to try and improve our position were linked around productivity. Our productivity in the year using the NHS England measure was an improvement of 5% on the previous year. And that compares against an average across the acute trusts in England of 2%. So again, we're proud that we've managed to significantly outperform the average in productivity improvements. In terms of cash, our bank balance went up quite a bit in the year, by 16.1 million to 43.8 million. If we eliminate from that the funding that we receive from NHS England around deficit support loans and revenue, etc., actually it's an outflow of 26.1 million in kind of real money, and that lines up quite well to the deficit that you can see of 27.1. Capital expenditure, as you can see, we spent 27.8 million on our capital. You saw in the video a number of the schemes that contributed to that, the Andover Community Diagnostic Centre, the elective hub at Winchester, and also some of the preliminary works around the new hospital were some of the things that contributed to that. And then obviously there's all of the works that you'd expect around maintaining the estate, updating IT, and medical equipment, etc. So that, in a nutshell, is the financial overview.
Thank you, Steve. And as Steve Erskine said, there will be opportunity for questions. So if you've got questions for Steve on the money, he is still here later for the Q&A. Thank you, Steve. The year ahead. So annual general meetings are, as we said, about reflecting on the year that's gone. But we are now in the year 24-25, and in fact, we're halfway through that year, or near enough. So we did just want to include one slide on what are we doing now and what are our plans for this year. And what you've got here is our 5 strategic themes that hopefully you can all recite by memory now, because we've repeated them a few times in this meeting this evening, and some of the key bullet points. So under providing outstanding care for every patient, we have 3 key areas about patient safety, quality outcomes that matter to patients, and about experiences of care. And some of the things we're doing at the moment in that area relate to our Safety Together, Everyone's Responsibility programme, which we've grouped a whole load of initiatives, some called Connecting with Care, where senior leaders are out and about, and in your shoes periods. You would have heard Steve just talked about an in your shoes experience with a volunteer in the emergency department. But how do we get out there and really experience what it's like for our frontline colleagues so that we can make things better for them? But it's also about putting a real safety culture so that everybody knows, everyone's responsible. If anyone can see something that we could be doing that's better for patients, that's safer, then we want to know and we want to make a difference. Also in our quality of care, we are focusing on urgent care. Today we're going to hear a presentation about planned care, but urgent care, our emergency departments and such like, are really important places where we know we could improve the experience for our patients. And we've done that through things like opening a new minor injury unit out at Andover. We moved the location, a much nicer experience for patients using a minor injury unit, right next to X-ray. They used to have, to anyone that knows the Andover Hospital, you used to go to, yeah, I see some nods, you used to arrive at minor injury, and if you needed an X-ray, you had to walk all the way across the hospital site to go and get your X-ray, which probably wasn't ideal. It's now right next door. We are working at the moment to see whether we can open urgent treatment centres in Basingstoke and Winchester, reconfiguring our emergency departments. We haven't absolutely signed that off yet, but it's a work in progress that the teams are really exploring, again, to enhance that experience of urgent care for people that don't need the full emergency department. And under planned care, we're doing a lot of work, which you will hear more from the team, about getting to the place where nobody will have waited more than 65 weeks. That's our target for the end of this month. We will have a handful of patients who we haven't seen by the end of September, but a handful. And then we start looking at the people who've waited more than a year. I mean, that's still a long time, 52 weeks. But if we think where we came out of COVID, that is progress. So that's a lot of focus around outstanding care for patients. I do need to say under this as well that yesterday was World Patient Safety Day, and the team ran a brilliant conference yesterday thinking about patient safety and particularly diagnostics. The second area around making the place a great place to work, making sure we have the right people with the right skills and a supportive environment where people can be at their best. We're continuing with our apprenticeship programs. You saw some of that in the film. We have more and more people doing apprenticeships. It's a fabulous way to give our existing staff the chance to develop their skills, but also bring new people into the workplace. We're working on our managers' skills. One of the things through the staff survey that we don't feel we've got right is people always feeling supported by their direct line manager. And some of that is because we haven't invested in those managers. And we've taken brilliant clinicians and we've said, you can be the manager, without really telling them how to do that and supporting them in that. So we've got to focus on leadership and management skills. And that's a real focus for them for this year. And then continuing our focus on equality and diversity and recognising that 28% of our workforce are BAME. We've got work, you've heard about our neurodiversity network. We've got so many different people who work here, and we want to make sure every single one of them is able to do the job they want to do, feel supported and developed to be the very best they can. So real focus on our equality and diversity programmes to make that real. Working together for our population, so working with our partners as one health and care team. I mean, the number of patients who say, I can't believe the GP didn't know this, or Southern Health did this and you came to the hospital and you didn't know about it. How can we join up healthcare so patients don't have to navigate all of this NHS fragmentation? So looking at how we do that, we saw in the video about the radiology systems are now connected. The pathology, the blood test systems, we're working on a programme this year that will connect those. So if you've had a blood test in one hospital, that'll be more visible to people in other hospitals. And thinking about our IT strategy, which will come under innovating, about how we make sure all information is available wherever you are in the healthcare system. And then improving the health of people and communities to serve and reduce health inequalities. So really thinking about how we work with people in our more deprived communities, people who maybe find it harder to access healthcare, and make that much easier for people. You heard Sarah in the film talking about call before convey, and that's about saying, let's not bring you to hospital if you don't need to, if we can get the care to you. So that's all about how we're working with GPs, the ambulance service and others. And actually we've done such a good job that the rest of Hampshire and the Isle of Wight is asking us to help them with the whole call before convey thing. Making the best use of our resources. So this year's financial position is no easier than last year. In fact, it's considerably harder than last year. It won't be a surprise for anyone that reads the newspapers. But we've set up our delivery unit, which is, we've pulled some really brilliant people. Ben, who's going to be on the stage a bit later, I think, and other brilliant people together to say, how do we get pace behind some of our cost improvement programmes, really accelerating those productivity improvements that we've seen. We've got some big projects that are landing after a number of years of effort, including the scanning of medical notes. So I don't know how many people in this room have ever been into a medical records library in a hospital. I first went in 20 years ago, and I remember going into this big room of paper notes thinking, the NHS runs on this? And that was 20 years ago when the rest of the world seemed to run on computers. We still have an awful lot of paper notes, but over the last 2 years, we've been scanning them in so that actually the doctor sat in the clinic can look on the computer, see the notes, but then actually, if the patient goes up to the ward, they don't have to, oh, I need to send the paper notes with it. They're available on the computer. And that has been an amazing project. That took a bit of going. I can see Shirlene. Shirlene's been our senior responsible officer for that. Has taken a lot to get going, but we are now almost complete with having scanned a whole load of historical paper notes. And then in innovating for a sustainable future, the big thing here for the last few years has been our new hospital programme, and it was brilliant to do the consultation this year. We are continuing to move that forward. Don't believe everything you read in the paper. We have been told to keep working to the milestones that we have been working to. There is a national review, and we'll see what that says, but we are still working to a 2032 opening for the new hospital. Now, it may all change, nothing's certain except death and taxes, but that's the plan we're still working to. So we're happy to answer any questions on that in the Q&A. But also here, we this year have implemented a new IT system in our emergency departments called Maya. We've implemented it here. Southampton are going to be implementing it down there, which means we'll be able to share information if patients come to us and then go to Southampton or vice versa. But it also is much better for our clinicians. We continue to look at green team competition. We're running another one this year, so more of our teams putting their sustainability plans forward. And we continue to try and find get all the benefits from things like our digital investments and our estates investments. So the same strategic objectives, but a new set of projects. Some of them are carrying on, some of them are new, all wrapped up in how we provide outstanding care for everyone that needs us. So that is the end of our wrap-up of the year, and I'm handing over to Steve for questions and answers. Thank you, Steve. Oh. Please do.
I think the applause was for me coming up.
I know it was, of course.
Okay, so I did say that we would give you the opportunity to engage with us and to ask us questions. We've got our executive team here, who are the experts in everything in answering questions. So Tim Powell, Chief People Officer, Andy Hart, Chief Operating Officer, Julie Dawes, Chief Nurse, Ruth Williamson, Chief Medical Officer, Shirley No, Chief Strategy and Population Health Officer. Did I get that right? And Steve, you've heard of, Chief Finance Officer as well. So the whole, Alex, any difficult questions, obviously, the Chief Exec would like to take on. So we're going to take questions. If you put your hand up, we've got a roving mic. Andrew's got that there. We've also got some questions online, and we'll probably just intersperse the two. So anyone like to ask a question? Let's take one of the online questions first, and then you can think about your questions, and we'll pick them up. So, Will.
So we've got one question, which is how much money has gone towards the new hospital programme and what has it been attributed to?
Okay. I mean, and then Steve come in or others. So the new hospital programme has been funded by the Central New Hospital Programme. So the first thing to say is none of the money that would have been spent on other things in Hampshire has gone on it. Every single penny, we have made sure that we've had national funding. Two reasons for that. One, we want to make sure that that we're not spending money we could be spending on patient care in Hampshire. But the other is it tells us that the national body is behind our project. We're not doing this against them or without them knowing. They are funding every step of the way. I haven't got the absolute total, and I don't know if Steve's got the absolute total. No. So probably what we need to do is publish that because it's running now. So we've got teams in place now that we're paying to do the work. The other things it's gone on are the public consultation. We spent some money on that to make sure we got good reach and we talked to a lot of people. In order to get to public consultation, we had to do things like land surveys to say, where is there land in Hampshire that's big enough to build a hospital? And you have to pay experts to go and do those land surveys. We've also paid some of our clinical time, some of our clinicians to help come up with the very best models of care for the hospital programme. So those are the kind of things it's gone on. Okay, we've had a bit of a philosophy about trying to use our own people and employ people rather than management consultants. So apologies for any management consultants in the room, but as much as possible, if we can get the expertise in-house, that is our preferred way forward. Occasionally, like land searches, that isn't really our bag and we have to pay the experts to do those.
Thank you. Alex, questions in the room? A couple over here, Andrew. This is a test of how fast Andrew can run now.
Hello. Two friends of mine recently told me, with a big smile on their face, one said she couldn't believe it, she had a GP appointment at 7:30, and the other one said she had an appointment with a consultant in Winchester on the Sunday. Now, is that something new that we're doing?
So I don't know what specialty. The specialty that's been doing it for a long time is stroke. So I quite often get thank yous from people saying, oh my goodness, I had a funny episode on Saturday and they got me in to see a stroke consultant, or have a CT scan Saturday afternoon, see the stroke consultant on Sunday, and it was all done before Monday morning. I mean, so that's astonishing. But lots of our specialties and our doctors do work weekends and cover things. I don't know whether, I'm looking at Ruth, or whether Ben or Tim want to come in on that in terms of weekend appointments.
Ben? I did promise I'd involve you, didn't I?
You did, and more and more we're offering a 6 or 7 day service in a lot of our services. And I'm not going to steal Claire's thunder, because Claire's going to talk a little bit about our extended weeks and the way we've used that to address some of our waiting list issues. But it's more and more common, and I think it's fitting in with patients' needs, patients' requirements, and timetables. And it makes best use of our resources as well, because we have all these expensive scanners or expensive operating theatres, and it's wrong that they sit idle at the weekend.
Okay, thank you for that question. Other questions? Andrew?
Good evening, everyone. Unfortunately, I missed the little video because of having to take a call. So I don't know whether maybe I missed something because of that. But the 5 main objectives, if we're trying to improve on each of these, I think it would be, my question is, are we looking also at what more systemic failures or not very good things are happening that would apply to all of them? So, in other words, are we considering how maybe there are certain things that would apply to all that could be improved, as well as then diverting out specifically to one or the other? And I would say personally, both as a patient and a governor, I think communication with capital C is the single greatest issue within the NHS.
Thank you, Tanya. That's a good question. Alex, do you want to respond?
Yeah, definitely communication. I think the other thing that came to mind is our quality improvement methodology. So we haven't talked that much about it, but actually we try and use this consistent methodology to go, what's the problem, what's the opportunity, what do we think could be better, what are the actions that we put in place. We test and learn, we do the PDSA cycles and such like, and we've used it for sustainability and carbon, we've used it for money and productivity, we use it for quality improvement, we use it for kind of everything in terms of our workforce improvement processes. So that would be the other thing, that kind of using a consistent methodology that actually speaks to all of those streams would be something I would call out. But I don't know if any other colleagues. Yeah.
Any comments from the execs on any of that? Julie, you look like you're about to want to speak.
Sorry, I would have said the same thing about the QI methodology. Is one of the things that runs right across all our objectives there, about an underpinning methodology of how we look to learn and improve. I think just in terms of, probably just worth mentioning for this specific one around safety improvement, the new PSERF, as we've called it, the new framework that allows us to report and look at how we learn lessons with a kind of no blame culture, and really looking at how we understand what's happened, how we can improve it, and allows us to look at it in a thematic way. We've got so each year we have a safety improvement plan that allows us to look at information from complaints and incidents to say, rather than just looking at individuals, what are the themes that are coming out, and let's actually focus on those themes. And that last year was the first time we had that improvement plan, and we're in the process of developing the plan for next year. So that's been a really helpful methodology to allow us to do that.
Okay, thank you. Thank you for the question, Tanya. Any other questions in the room? Towards the back there. Come to you in a minute, sir. Madam, sorry, it's the light.
I had a question for Steve West. I remember a couple of years ago, Steve, you said that it was about £1 million a day to run Hampshire hospitals, and that gave context for the other numbers. And I just wondered, what is the annual? Because it was interesting to see your deficits and where you've made it, but I wondered, how much is the organisation spending now, if I've remembered that correctly?
So, off the top of my head, it's around about 600 million a year is what we spend, give or take. So,
just Mindy. Mindy.
Sorry. So the overall cost base is around about 600 million.
So nearly double what it was.
Yeah.
Okay. Our favourite question.
Hi, Steve.
Hi.
Thank you. That was really interesting. I love the video, actually. I thought that was a really good way to present those pieces of information. Very encompassing. A question about the ability to digitally send the information around our trust and around Hampshire. A lot of people are, in fact, nearer Berkshire or nearer Surrey. So what are the plans for actually making that information and results, etc., available to them as well?
Yeah.
I just wonder if Ruth should have a go.
Yes.
I think I know what the answer is going to be, but...
Thank you for that question. I think it's a real challenge in the NHS is to look at what is the right size of information sharing. How do we make sure that your information is private where it should be and shared where it needs to be? I think we've still got a long way to go. There are some national programs which are looking at, for example, in my field, image sharing. How do we make sure that images taken in when you're on holiday in Stockport are available for us here and vice versa? I think we've still got more work to do around our boundaries, but we know that that's our issue. There are lots of different ways we can communicate. The good old-fashioned phone sometimes is a really good way to do that. So I think still lots of work to do. It's easier when we are all connected within Hampshire and the Isle of Wight to then work on 2 or 3 boundary points rather than lots and lots of different ones. So I'll stop there.
Okay, thank you, Ruth. Any other questions in the room? Two here. Brian, sorry. This lady here first and then Brian. Oh, sorry, yeah, carry on.
You can hear my voice, of course. Doing blood tests by appointment takes 2 weeks now to get a blood test. It's a very, very inefficient way of doing it by appointment only. If you do by footfall in, not every appointment will take exactly the same time and people can get actually through much quicker. Are you going to change that or are you going to keep to the appointment-based system?
Okay, now I didn't think you were having to wait 2 weeks for that. I thought we could get the appointment, so that I can see some puzzled looks in the room as well.
I rang up I tried to try to book an appointment. Actually went up there one day when there was nobody there. And they've got this convoluted telephone system now. That you know, you got to put stuff in and this next appointment.
Okay. There's a website as well, isn't there? But is that too difficult? Okay. I'm looking at Andy maybe to... Yeah.
Go on, Andy.
Well, I'm going to answer the question really honestly and say I don't know, but we will find out, because actually I will go and have a look at what the weights are, because to be honest, you've done it in a different way than I'll see it. You've done it as a patient, so if that's how it feels like, we'll go and have a look at it.
But even GPs are complaining they can't send the patient to the hospital, not just here.
Yeah.
They're actually the appointments.
Okay.
Yeah, I mean, one of the challenges we do have is how we use the resources to get people booked in and maximise the efficiency in that. So by booking appointments rather than having lost capacity. But I'm now making comments. I'd like to go away and have a look and see what it genuinely is.
I think people used COVID to slow everything down. From Basingstoke down, using the same, it's almost like, you know, like to have a GP appointment, you've got to fill in a form. That you then go to see your GP and nobody's read it, but you spend 20 minutes filling it in.
So what I will say is, what we strive to do is to have no time in a patient's pathway where nothing's happening for them. So any waits where somebody's waiting for something is what we call red time, and we do our best to try and get rid of those red times. So people are waiting for a test, they're waiting for a result. There should always be something actively happening for a patient. So your feedback is really helpful. Let me go and have a look at it.
So Andy, just so I'm aware, so somebody's asked a question and we're going to go away and think of a response. How do we get the answer back to that individual? Is that something we'll publish the answer to that? How are we going to do that?
Yeah, we can chat to you at the end.
Yeah, okay, so I just want to make this quite, so sometimes we can answer the question very honestly, and sometimes we need to go away. I want to make sure there's a mechanism by which we get that answer back to you. All right? Brian, I think you had your hand up, and then there's a couple of...
Sorry, I will second that lady.
Okay, thank you. Got it, thank you. So that's enough evidence then, isn't it? Brian, were you going to ask a question?
I'm afraid I'm going to give completely the wrong impression now.
Well, do it in the microphone.
Because the last time I had a blood test was Sunday. No, I got a text message from my GP surgery on Sunday we managed to get the asinine, the website to work. We didn't, actually. We just phoned up and answered the questions on the phone. I then got an appointment to go in on Monday morning, and the results were on my NHS app on Tuesday. So that's my experience on last week.
Yeah.
Okay.
So it's
That's how it
not,
should
I don't
work.
know where these people are getting these numbers from, but that's,
Well, I mean,
we need to find out.
at the end of the
but
day,
there again,
Brian,
I'm always lying.
At best, we've got inconsistency. and that's
At
not
least
right, is it?
inconsistency.
Yeah.
But one thing you have got is an awful website for that particular service. And Joss isn't still here, I don't suppose. Anyway, never mind. Okay. I've been listening really, as I always do, to Alex really, really hard, because she's wonderful to listen to. And I also listened to, I can't remember his name, Lord, can't remember, and because it's all because my brain's leaking out. We just had the thing that new governments do, which is commission a report. And the report has said the NHS is broken, not in difficulties or seriously challenged, heard those words before, but broken. First of all, I didn't feel broken for the 9 years I was a governor here. So I didn't hear that was broken. I heard about the difficulties and so on. I wondered if Alex thinks about areas that you could publish that are parts that you could consider broken in a spirit of amazing openness and probably not much care for job security. But what is it that we can say, or you can say now, we can say, I'd like to say it, that tries to reassure people it's not broken, it's not that broken, but you've caught us on a bad day at least. All right?
Yeah, it's good. It's good. You must have read my slides,
Yeah.
Brian, because I was coming to that point, actually, about there's political rhetoric, isn't it? And there's political stories. I think you've seen examples on the screen today. You've heard Alex talking. You're going to see a really good example coming up now of brilliant service that we give to our patients and care. Now, we don't get it right all the time, and we know that. We've let people down in a number of different ways. We've got people in our emergency departments who shouldn't be there. We've got processes. We've got a problem with the money. We've got people in hospital who shouldn't be here because they should be in another set. There are lots of things we need to do better, and we absolutely recognise that. But when you go out on the shop floor and you see our staff working with our patients, look at some of the examples that were in that video, listen to the example that's coming up. Those are dedicated people working hard every single day to provide the best care they can under the circumstances under which we work. And frankly, it's not fair to them to call the NHS broken. So I don't believe it's broken. I think there are things we can do better. I think there are things we can improve. It's really, really pressured out there at the moment, but it ain't broken. It's an easy political slogan to use. It's an easy throwaway comment to make. But actually, when I speak to the people in this organisation working really damn hard every single day, I don't think it's fair on them, and I don't think it reflects or respects the role that they play. And I think what I've heard from the Health Secretary, having heard him a couple of times since the election, is they're changing the language now, because one, it's not politically imperative anymore to use that phrase, but also to recognise that actually the foundation of good service is there. There's just stuff we need to do better. That's not a broken service. And I would challenge anyone here, and I know you will all probably have examples of where it's not very bloody good actually, but actually if you go and then the majority of time, our people are doing a great job and they are delivering safe care to patients. But thank you for saying that, Brian. Any other comments from, shall we just hold it? Let's have that question from that lady there, and then we'll just have a look at the online questions as well.
The lady by Andrew has been waiting for ages.
Oh, sorry. Is there somebody who's been waiting long? Andrew, I rely on you. I can't. You find the people, then they can ask the question, can't they? Sorry, carry on.
Okay, I would like this question to be answered by Tim Powell or Charlene O. Can you imagine a workplace where bullying is preventable?
Good question. I think Tim will want to try that one first, do I?
Yeah, what a fantastic question. Can I imagine it? Yes, because I think that's absolutely what we should strive for. If we think about Great Place to Work, one of the key themes that runs through all of that is the physical, psychological safety and well-being of our people, because that's really, really important. We can't deliver, I think, safety to our patients unless we deliver safety to our staff, first and foremost. But we know that there are challenges within there. And we can have the best set of values, we can have the best leadership model and everything else around, but we know that some people and the way they interface with one another is not always where it should be. We have to be intolerant of that, because the more, people have heard me say this before, the more you tolerate variation in behaviours, the more variation in behaviours you will always get. So yes, I can imagine it. Do I think we're there? No, we're not. The data tells us that. You know, the number of cases, the number of staff stories I hear tell us that it isn't that. But we will work relentlessly to make sure that this is a great place to work for everybody. Nobody comes in to work and should feel psychologically unsafe at any point, particularly at the hands of anybody that feels that it's right and proper to bully them.
Shirley, did you want to say something?
Thank you, Tim. I would say that we are doing more than imagining it, because we are trying to address it as we experience it. And it is quite a personal thing, because having experienced it and seen it, it's really quite hard when people have firm beliefs that are hard to change. So I'm not pretending that it's an easy thing to do at all, but I think that if we all hold firm and if we genuinely addressed it every time we faced it, that probably is the way to do it. Because I think just by saying it, it's not going to happen. We really need to make it personal, and we need to be consistent in the way that we address it and approach it.
Okay, we'll come back in the room in a second, because I know there are other questions. Should we do some of the online questions as well?
Yeah, so we've got one that came in advance of tonight, which is, what steps are the hospital taking to address staff burnout and improve morale, ensuring adequate support and resources are available? Is there a possibility to increase education and/or budget for staff?
Okay, Tim, I think that one's over to you.
Gosh, there was quite a lot packed into that, wasn't there? Let me try and unpack that and see if I can answer it. I think I've mentioned psychological safety and well-being for our staff already. In terms of specifically what we are doing about that, well, actually, if you look at Great Place to Work, and you see the first bit on there is around right people, right skills, right place, right time. The financial challenges will not prevent us from making sensible decisions about staffing and staff levels. Okay, we will maintain staff levels because that's right in terms of safety for patients, but also safety for staff. Okay, so we will always, as an executive team and as a board, make sensible decisions in relation to that, because we know when there isn't sufficient resource in place, that's a key factor in terms of burnout for staff. There are a number of other areas that we're looking at. Alex has already referenced, a real focus on leadership, and leadership and staff well-being and burnout, two sides of the same coin for me. So a real focus on leadership. But there are also some very specific things that we're doing. So, part of us in terms of looking at our well-being strategy going forward is going right back to basics for staff, in terms of just making sure that people get breaks, that there's safe areas for breaks for staff to have. Even, and some of my colleagues know this, I'm kind of on a bit of a crusade at the moment around 24/7 nutrition for staff, in terms of making sure that's available. So all of those basic things absolutely need to be in place. But we're also doing some very kind of specific targeted areas. So we know for our resident doctors, that's the new term for junior doctors, by the way, as of yesterday, I think. We did a survey survey about a year ago, and it was called a burnout survey, and we saw some real marked kind of challenges and issues there about that particular group. So we've actually got, with our chief residents and other groups of resident doctors, we've got a focus group that's been going for a year now, looking at that, looking at how we can get better at rota coordination, better at the training experience, better at the senior consultant and trainee interface. Lots still to be done on that, but some very specific work, you know, around all of those things. In terms of resources and training, we've not cut back on our training allocation at all in relation to the financial challenges that Steve described earlier. You know, we are making sure that we still, you know, maintain people's kind of continuing professional development within the roles, and we will continue to maintain that, making sure that people have got the right resources to do the job going forward. And in terms of morale generally, you know, there's a lot that we're trying to do. You know, Steph's here as our new People Promise Manager. So we, you know, we're part of an NHS England-wide project at making sure that people stay in the NHS, don't leave the NHS. Ashley, full-time Freedom to Speak Up Guardian, you saw through our staff survey results that where we have seen a decline, it's around people having a voice in the organisation. So really trying to strengthen the avenues that people have when they've got concerns. They've got a safe place where they can raise those. So lots and lots going on in that space. Have I kind of answered the multitude of questions that I think were in there on that? Okay, great, thanks.
Okay, thanks, Tim. Anything else online we want to pick up?
Yeah, we've got a couple more that came in advance. So how is the Trust collaborating with other institutions or organisations on research projects, and are there any plans to increase funding for research activities?
Chris, do you want to pick that one up? Thank you.
Yeah, thanks very much. So I come from a research background, so I'm always keen to promote it. The research I'm doing is with Portsmouth University, UCL, Bournemouth University. We are building relationships, obviously, with Winchester University, which is our closest, with Southampton University, and importantly, not just in the health and social science faculties, but I work with the engineering faculty there to look at how we can work with engineering and computer solutions to help our patients. So we are always open to growing research. In addition to the, if you like, academic research, we are also trying to work with commercial research partners. So some of the drug trials that will bring new vaccines, new treatments to patients are things that we support here, and they have the double benefit that the funding they bring in helps to build our research infrastructure.
Okay, thank you, Ruth. Anything else online we need to pick up? So we'll come back to the room in a sec.
Yeah, so we've got, how is the Trust encouraging a culture of innovation amongst its staff? Are there any plans to invest in new technologies or equipment?
I think Charlene's going to have a go.
So building on our improvement approach and methodology, we have innovation as well, because as we seek to improve, there is always something new out there that we want to adopt. So we have invested already, as Alex has just highlighted, you know, in a number of areas in digitization. We are looking at bringing on robots in surgery, and colleagues might want to talk about that. We will be, as part of the new hospital program, looking at adopting innovation in our digitally intelligent hospital and in the way we deliver services as well. It's not always about technology. Sometimes it's about ways of working. So again, in how we work with partners, for example, in virtual care, when we are looking to work with community mental health providers and primary care, we're looking at the technology platform that supports that. So sometimes it's the ways of working and how we deliver service that we're looking to innovate. So in a whole range of areas, we are starting now. We are not waiting for the new hospital to come, because we know that we need to change how we work, how we provide service, how we run our estates going forward. So we're starting that journey now.
Can I just give a shout out for our charities as well? I think I'm all right, yeah, because sometimes those innovations, the Hampshire Medical Fund is a brilliant charity that raises money for the hospital, but particularly in this innovation space. But we've also got the Hampshire Hospitals charity and other things. So sometimes those fund streams allow us to do things that we couldn't try with NHS funding directly, and we are currently fundraising for our robot. So if there's anybody out there who happens to have some money down the back of the sofa, that would be great. But yeah, it's a brilliant partnership when we work with our charities to do these things.
Okay, so I think we've got one more online, and then we'll come back to the room for the final couple of questions before we move on.
Yeah, one more. So are there any other personal highlights from our executive team over the year that weren't squeezed into the wonderful video?
Love it. So we've got another 18 hours then. I mean, I guess just exec colleagues, that you don't all have to answer, but is there anything that hasn't come up here where you think, do you know what, that's something we're really proud of, or not proud of even? Go on, Andy.
I'm going to stick to the proud of. In the last 12 months, we have treated more patients. We have been more efficiently using our resources like theatres and outpatients, and the long wait for patients has decreased, and the total waiting list has decreased.
Yeah, good point. Thank you for that. Okay, let's go back to the room. We'll have to take a couple more questions, and then we'll move on. So I know this lady here had her hand up. Yeah.
Good afternoon. I'm glad that gentleman just said the long wait patients has decreased. I have been waiting for the pain clinic for the last 8 months, and I'm not quite sure what's happened. I think I was just being forgotten. But it's not funny sitting at home in pain and you just don't want to be there.
Yeah.
So I'm hoping that you can take a look at that and try to get that reduced as quickly as possible.
I'll tell you exactly what we'll do. We'll take your contact details and we'll follow that up with either Julie or Ruth, or probably Andy.
Yeah.
But we'll come and if you wait behind at the end, someone will come and talk to you, and we'll follow that up just to see what that's got for you. All right?
Thank you very much for that.
Okay.
But there's a second thing to do with students. I've been a nurse at Hampshire and High Wycombe Hospital, and the way I started was a cadet nurse. I saw them wanting, the matron there, as you had at that time, wrote in the mirror that they were short of staff and they were looking to see what they can do to improve it. And I wrote to her, and I was 16 at the time, age 16. I went for my dad took me for an interview up there. She just didn't want me to, to let me go. So she hung on to me till I was 18 and ready to start my SRN. And I think that could be a lot for students. There's lots of people want to be a nurse, and there will always be, but there's always some in the background that don't know what to do.
Yeah.
And I think we could go into schools and try to explain to them what nurses do. Bring them to the hospital. Let them go around with the nurse, put on proper uniforms and that, and give them the experience. And even if you get 2 or 3 out of 10 to join, you're increasing the amount of nurses that could go to Basingstoke College and do the work when they're 18 to start doing the training.
Yeah.
So could you please consider that?
Yeah.
I don't even mind volunteering to go to the school to help you to do that.
You may regret that. I'm going to ask Julie, I'm going to ask the chief nurse to just respond to you. Yeah?
Thank you, and I can see why you just wanted to keep you. I couldn't agree more, actually, and we do actually do quite a lot of that. So we do have programmes where we've got staff going into schools and sixth form colleges, and we're trying really hard. For example, we're working with Sparshot College on the T levels, and part of that is that while they're studying their A levels, they come in and do a work experience. We've got a brilliant scheme for Duke of Edinburgh, for example, where they're coming and doing placements with us, all with the aim of giving people a greater opportunity to understand at a much earlier age what it would be like to be able to come in. But we can never do enough, and we have done a lot on different programmes to allow people to come into training, because that is aimed very much at the sort of 16, 18-year-olds who maybe want to go an undergraduate course. But we've also got a lot of people who want to come into nursing at a later point in their career. So things like, as Alex said, the apprenticeship scheme is a brilliant opportunity to allow people to earn and learn and have a different pathway in. But that said, we still haven't got enough. So I will definitely make touch with the outside. Yeah, definitely. Yeah,
It's a
yeah.
good point.
Good, it's a good point. Yeah, yeah.
That's a good point. Thank you very much for
I remember those days.
Okay, I'm going to take one more question from Soraya. Sorry.
Where am I?
Okay.
Following a research question earlier, I have had Parkinson's for a number of years and used to help at pre-COVID at Oxford. But I volunteered here for Basingstoke, and the recent update said there's nothing suitable available. What areas of research are you actually in?
Ruth, do you want to? Yeah. I guess you're not going to go into the detailed answer to that, are you?
Yeah, we are carrying out research at the moment in a variety of areas. You probably all know that we've got the Pseudomyxoma Institute here, which is one of 2 places nationally that treats a very rare form of cancer of the abdominal cavity. They're a very research active program, but it's not just them. Our orthopedic team has done a huge amount of research, for example, on helping people recover quicker after joint replacements. Alex and I were at a meeting recently where the length of stay for someone with a hip replacement has gone down from nearly 2 weeks to a couple of days, with consistent pieces of evidence-based research to help people recover quicker. So I think I couldn't do justice to everyone's research. We've got cancer research, we've got orthopedic research, we've got pediatric research, we've got vaccine research, we've got research in so many areas, and I just feel really it goes out to you that we're not doing research in Parkinson's disease for you right now, but you know, we want to be able to offer every single one of our patients the opportunity to be part of medical research relevant to their condition, if at all possible.
Okay, thank you. Tanya, I know you put your hand up. We have another Q&A at the very end, and I want to try and move us on. So can you hold that thought until the end for us?
Yes, of course.
Okay. Right, so the next bit of the agenda is for me to introduce Dawn Taylor, who's our lead governor. Governors play a crucial role in the governance of the organisation, and it's only right as part of the AGM that we hear a bit from our Council of Governors. So Dawn, over to you. That's all right. I'll catch you if you don't mind.
Thank you. Good evening, everyone. I haven't got slides, so I want you to listen, please. Okay. Good evening, and thank you for attending our AGM tonight. I'm Dawn Taylor, and I'm lead governor and elected public governor for North Hampshire and West Berkshire. It's a post I've had for the privilege of holding for the last 7 years. I am grateful to our support of all our governors, every single one of them. They might be a pain in the butt sometimes, but they do support us, and they're brilliant in what... Sorry, Tanya, I thought it'd be you. Okay. Okay, I'm grateful for the support of all our governors, and I want to thank each of them for their dedication in the post that they've been elected to. We especially want to thank Alex Whitfield, our Chief Exec, for her steadfast leadership and dedication to the Trust, an example she sets to us all. Governors are not involved in operational matters, but play a key role in deciding the strategic direction and development of the Trust, bringing the views of the community to bear on Trust thinking. The Council of Governors has, like everyone else, had to change the way it works. Whilst the use of virtual meetings is useful, it's not as good as seeing each other face to face. However, we have continued to hold the non-exec directors to account and have ongoing dialogue with the executive about the direction of the Trust. As we work our way through the recently published Lord Darcy report on the NHS, a changing government, and the creation of the ICB, with all the uncertainty and challenges they each bring, we can see that in the future there may be many changes for us all to get used to. But change can also bring with it many new opportunities. The future of our healthcare in Hampshire has already taken up its position on the start line, with the Hampshire Together and Mows programme for the new hospital a top priority. Whilst many of our staff receive awards, unfortunately we cannot reward everyone. So the Council of Governors would like to give an outstanding award to each and every member of our staff, everyone that stumbles out of bed and places a blue NHS lanyard round their neck or pulls on an NHS uniform, all those that turn up day and night, summer and winter and weekends, all those that commit to caring for our community. Even when it's hard going, they rise and face the day, knowing that due to their professionalism, babies will be born, broken bones set, the sick cared for, and the injured able to recover. That through their personal efforts, the hospital estate will continue to function, thousands will be fed and staff will be paid. We will be safe at work and staff will be trained and new colleagues employed. The NHS and this hospital is one huge team, and I am proud to have been part of it in the past and in the present. The Council of Governors wish to thank Steve Erskine for the outstanding way he has led the Trust as chairman. His openness has meant that governors have had confidence in what he's told us about the situations the Trust faces. His positivity and pragmatism have ensured that he also has the confidence of the staff and the rest of the board. He has supported us all, and he will be greatly missed. Thank you, Steve, and we wish you good luck in the future. In closing, we as your Council of Governors wish to assure the people of Hampshire that the Trust, no matter what challenges they may face in the future, will always be committed, ensuring that the safety of its patients and staff remain their #1 priority. So thank you for your time this evening, and please enjoy the rest of the AGM.
Thanks, Dawn. And I just want to comment on Dawn in her role as lead governor, because it's not the easiest job in the world. And Dawn has always provided the board with a conduit to the governors with some of that more informal intelligence that we sometimes pick up. And Dawn, I know you've done a cracking job in engaging with your colleagues and actually coming to us and saying, actually, there are things that the governors would like to talk about, helping us shape the agenda for the way we deal with the governors going forward. And I think you've done a cracking job in the role of lead governor, so thank you very much. And you are the chair of the National Lead Governors Association now, aren't you, as well? So congratulations on that. Now, not that Dawn wasn't exciting, or Alex, or the video, or anything else, but here's the exciting bit of the show now then. No pressure then. So I'd like to welcome our colleagues from our surgery division, and they're going to talk about those waiting times. We've alluded to that a bit, but some of the really innovative work they're doing to reduce those waiting times. So I'm going to introduce Claire Rolt, who's Deputy Ops Director for Surgery. I can see Tim and Ben there as well. Claire, over to you.
So, hi, I'm Claire Rolt. I'm the Deputy Operations Director for Surgery. And what I'm going to talk to you about, I'll keep near the mic, thanks, is I basically have the privilege to show you some of the great work that we've been doing across the division, that our team has done across the division, in terms of reducing waits for patients. As that lady pointed out, it's absolutely not perfect. It's not where we want it to be, but it has improved. Over the last 12 to 18 months, our staff, non-clinical and clinical together, this is focused on the surgical division, but it's also true of the other divisions, have made a huge effort in reducing patient waits. So to put it in perspective where we were, so at the beginning of, in March 2023, because we are going back sort of 18 months now, we had 30,000 patients waiting for routine treatment. 2,200 of those patients had waited over a year for their treatment. On a separate pathway, 38% of our patients had waited more than 62 days for their cancer treatment. And as we all know, long waiting times obviously impact your physical health, but also your mental health. And we're very, very conscious of the impact of waiting times on anxiety and mental health. Also your clinical outcomes, but also the for the working age population, it's very, very key to enable people to get back to work. Because some of these things may not be life-threatening, but they are actually life-altering, and they are preventing people from going about their daily lives. So we know how important waiting times are. A bit about the national context. So obviously, as you all know, we faced a little bit of industrial action in 23-24, and what that meant for the surgical division is that we had to cancel and rearrange 60 operations and 460 clinic appointments. We made sure that the priority was for emergency care, cancer, and then long waiting patients within this period. This obviously had an added effect that for our admin teams, but also for our clinical teams, there was a huge amount of rework around this. So whilst respecting the right to strike of our staff, this did add an extra layer. Also, in the same time frame, they introduced the ability for patients to choose wherever across the country they wanted to be treated, and we had to transfer those patients. So the amount of work that, for example, our admin teams had to do, in some cases tripled. So with that in mind, we set about the aim of reducing waiting times at all points of the patient journey. So what was really important to us was making sure our improvements were underpinned by putting the patient first. And where possible, and we haven't got this exactly right, but we're going to do even more work on this, particularly in pre-assessment over the coming year. I can see Martha there, about involving patients in their care. It was also about working together as a team, a multidisciplinary team, and the need to go above and beyond. Our staff really did go above and beyond over the last 12 to 18 months to try and produce reduced waiting times. It was also about trying different things, but in a safe way, and also about being clear about what we did every day and how that impacted every individual patient. So the picture on the right, as you look at it, is just about highlighting the fact that on every part of the patient journey, we set about trying to reduce down the time that you were waiting. So in terms of improving the start of the patient journey, in neurology, our clinical teams now provide advice and guidance to primary care to support all patients at the point of referral. This helps to reduce patients coming to unnecessary outpatient appointments, but also should enable patients to understand their condition and manage it slightly better whilst they are waiting for that outpatient appointment. Across all of our specialties, our clinical teams increase the number of first outpatient appointments, reducing that anxiety while patients are waiting at home to be contacted by the hospital. We also looked to flex our clinic appointments, and our admin teams were tasked with making sure that all of our outpatient appointments were booked out to 6 weeks. This should obviously improve patient experience because you've got a greater understanding, a greater notice period to be able to come to your appointment. So once you've started on your journey, obviously the next phase is diagnosis. We understand that improving wait times for our patients is very important because it reduces your uncertainty. We have reduced the number of patients waiting more than 6 weeks in key areas such as cystoscopies and colonoscopies over the past year. We also have made some improvements in some areas, for example in neurology, at reducing the length of time to a cancer diagnosis. So we have the standard, which is 28 days to a diagnosis within a cancer pathway. And for urology, we've now diagnosed 70% of patients within that time frame. It's important to note we still have some challenges around this. It's not where we want it to be. The national target is 75%, and actually once we achieve that, we still want to go further. So the focus is to make sure that we are going to work with our partners, because obviously we work across multiple providers with some of these diagnoses, to improve the length of time waited for a diagnosis. We're also increasing the number of patients operated on. One of the ways we've done this, again, it's about multidisciplinary working. Our administration teams have been amazing this year at really pushing themselves to make sure that all of the operations are booked up to 6 weeks before, the clinics are booked up to 6 weeks before, which is also in spite of the fact that they've had to rework clinics due to the national context. We've also introduced pre-surgery phone calls to patients to ensure that we reduce our on-the-day cancellations, and we've seen a significant decrease on the day cancellations, and we've seen a significant decrease in that. We've also changed the way we work in theatres, so we've made it 10% more efficient within theatres. So our utilisation in some areas has increased by 10%. And that's just about thinking about how we can streamline those processes to make sure we can see as many patients and treat as many patients and operate on as many patients as within the time frame. And also, as mentioned before, we are now working across 7 days. So we've done high volume, low complexity lists at the weekend. We've done outpatient clinics at the weekend. You know, our staff are flexibly working to meet patients' needs across 7 days. And the result of this is that we are, our patients are receiving more operations than comparable hospitals, than our peer hospitals. It's a pretty horrible graph, but essentially, the further along to the right you are, the better it is. And we are moving towards that right-hand side. And hopefully by mid-October, we're looking to have a wait time for cataract procedures from referral to the point that the patient has their procedure will be 10 weeks, which is a significant improvement and a massive achievement for our ophthalmology team. So once you've been operated on, what happens next? Well, you may well go on to patient-initiated follow-ups, which allows access to care when the patient needs it rather than when we say we're going to see you. We've also, as already mentioned before, I probably need to go earlier on in the agenda. I feel like, you know, I'm making up for things that have already been said, but it's a really good point and it definitely deserves reiterating. So we've gone from a 2-week length of stay for our total knee and total hip replacements to 2 days, which is incredible. And also for our nephrectomy, we're also in the lowest quartile in terms of our length of stay for inpatients. ENT are using different products post-surgery, which enables patients to be discharged the same day with the same clinical outcomes. And now up to 78% of our urology patients go home the same day. I think probably I speak for us all of when we need to be in hospital, it's great to be in there, but actually after an operation it is really nice to get home. So we're really proud of the fact that we've been able to improve our day case rates. Other areas which are slightly maybe off topic of the reducing weights, but really important to us, are our Peritoneal Malignancy Institute. As Ruth mentioned, they are a very research active department, but they've also seen an increase in the number of patients that they have treated over the past year. We're also very proud of our haemophilia service, who were recognised through the peer review process as providing a really gold standard to patients. Now, this is despite, as some of you might know, if you are patients of this service, not having the environment that they would necessarily like over the last year. What this team are particularly proud of, and will always talk to you about, is the fact that they have clear communication with patients and they have excellent psychology support, particularly important after the news this year around the blood inquiry. And there's a very, very good service as patients move from the children's to the adults one. So the result of all this work, and it is a whole effort from an entire division of staff, from admin to the surgeons to the nursing staff and everyone in between, we have got fewer patients waiting for cancer treatment. So we had 28% of patients who had waited longer than 62 days for their cancer treatment. We now have we had 38%, we now have 28%, let's get it the right way around. So that's a 10% decrease. Again, it's not where we want it to be, because this is a journey. We're not perfect, we still need to improve, but it is the result of a huge amount of effort from our staff. And we also have fewer patients waiting over a year for routine treatment. So we had decreased our total waiting list, so this is including, new referrals, etc., by 1,000 patients in 23-24. And there was a 61% decrease in the number of patients waiting over 65 weeks. As you can see, we still have a number of patients who are waiting over a year for treatment, but that's our next stretch. I'm very proud to work in a division that does not rest on its laurels, and an organisation that doesn't, and that actually that's our next step, that's where we need to go next. So, I'm going to open up to any questions that you have, and then anything that's clinical, I will defer to my colleagues.
Thank you. Questions? So, set of questions here for Claire on the presentation. She will, thank you. She'll pick those up, and then we'll have a final Q&A to close out the evening. So, any questions on Claire's presentation? Jenny?
No. But they'll turn it on at the back. Okay, try now. I think he's trying to see which mic it is.
Swap over. Go with this. Yep, I'm like,
okay. Thank you. Is that better?
Yeah.
Fine. Thank you. That was interesting to see the reduction in wait times, which is brilliant. I'm just wondering about post-operative complications. We whip them in, we do the job, we whip them out. What happens when something goes wrong?
Okay, I mean, that is the first one I'm probably going to...
I was going to say, that's probably clinical.
Over here.
So who wants to pick that? Benny, you're going to pick that one up?
Complications are a fact of life, unfortunately, surgery, and unfortunately they do happen from time to time. We haven't seen an increase in, thank you very much, in the rate of complications with all the hard work that's taken place to reduce the waiting list. We do monitor things like readmission rates. Every department, every surgical department has something called a morbidity and mortality meeting, which is where as a group we discuss complications that happen, we reflect on those, we extract the learning, and there hasn't been any increase or worries about increasing complications as a result of the approach that we've taken. But we have treated significantly more patients. Actually, by improving systems, improving processes, streamlining and standardising some of the systems that we've used, we've probably made the pathways much safer.
Any other questions? Sorry? I can't say, is that Tanya's question? Yeah.
Thank you. One of the areas you discussed quite early on in your presentation was around bullying. And I have a bit of a problem with bullying because I really think we need to define what is bullying. If you look at what bullying is considered now, and you went back 10, 20 years, it would not be deemed bullying. And my concern about overemphasizing people being at the receiving end of bullying, it's a real concern I have also with schools and everything. I think it actually disempowers the person at the receiving end to sort of I wouldn't say mollycoddle, but people have to also, in any workplace, learn to stand up for themselves. So I don't deny that there is bullying sometimes, but I think we need to define it, because sometimes just a raised voice or a sharp word from a boss doesn't constitute bullying where somebody could put in a complaint and everything. I think we've got to be very careful how we define it. And I don't know what the modern definition now would be. If I look at what I think it is, then I could say that I was bullied as an employee, I was bullied as a pupil, but it never came across that way, because I think if something went a bit too far, I probably had the guts to sort of say, hey, you know, I'm not going to put up with this. Something like that.
So you've helped us move seamlessly into the Q&A at the end. Can I just quickly check there's no other specific questions for Claire on that presentation? Okay. So I just want to finish this presentation, Tanya, then we will come back, because Tim's going to try and answer the question about bullying. It's a very relevant question, but I just want to say to Claire and the team, this is kind of a hidden victory here of people who've done, lots of people who've done a brilliant job at very slowly making an improvement. And you don't see it because it's not a big hit thing. But I can tell you, I speak to my colleagues around the country. So if you don't, those of you who don't know, I'm a trustee on the NHS Providers Board. So I get access to conversations right across the country in terms of the struggles that people are having in organisations, the struggle that hospitals are having. Other people would shoot for the kind of performance we've had in our surgery division, because they have much longer waiting lists. They have many, many more people on their long waiters list. And our comparison to other trusts is really actually quite positive. They have done a remarkable job. And it feels a bit like, yeah, okay, we've got a bit better. Actually, that's a huge improvement. It's a huge improvement in patient care and patient safety. And when I hear other people talking about their performance, it says nothing compared to what Claire's just talked about and what Ben and Tim and the team have done. So thank you for what you're doing. And actually, you might not realise just how good a job you've done. Well, I can tell you, when I compare to what other people say, they're nowhere near where we are. So well done, and thank you very much. Sorry, I think Ben's going to try and grab the last word from me.
I always try to. Don't often succeed. If it's okay, Steve, I'd just like to say it's been really flattering and really lovely for the surgical division to come and be invited to talk about the reduction in waiting lists. But I'd really like to point out there's been a whole organisation response here. Yeah. And actually, all of these patients or majority of these patients who've come for operations have needed scans, they've needed blood tests, their beds have needed changing by the domestics, they've needed food, and the surgical division have done some operations, but actually the whole organisation have helped support these waiting list reductions, and we should recognise that and celebrate that as well.
That's called That's called grabbing defeat from the jaws of victory, I think. No, but it's a very valid point, and it is the whole trust, and you've seen lots of examples of that today. So, Tim, can we pick up on Tanya's question, because we've moved seamlessly into, if anyone's got any further questions to ask before we close up.
Yeah, thanks. So Billy, we could spend all evening probably trying to talk about and define, an academic definition of what is bullying and what isn't bullying. I mean, ultimately, none of us should come into work and have our respect challenged, our dignity challenged at work. And, Ruth reminded me around, we have something very specific we use in the NHS called civility saves lives. And there's something about being civil to one another. That's important, not just because of our moral compasses and how we need to treat people, but actually there's evidence that when we're civil to one another, that plays through in terms of outcomes for patients. And actually, there is a direct correlation between being uncivil towards one another and mortality rates. So, it's important from a moral point of view, but it's also important from what we do in terms of protecting our patients. So that's why it's really, really important.
Thank you, Tim. So are there any other final reflections or comments or questions people would like to ask? Sir?
I've got an interest in getting people to hospital because I'm a trustee of Basingstoke Labour Care, so we get older people to this hospital and GPs. I came across something in the Daily Telegraph the other day that Mid and South Essex Foundation Trust were cooperating with Deep Medical to use Uber to get people to hospital.
Yeah.
And they were using AI. Oh, sorry. I don't know whether you got all that, but it was a trust in Mid-Essex that were talking to Deep Medical, and they were using Uber to get people to hospital and using AI to identify those patients who might not show up. I just wondered if this was on the agenda. I know you had a bit of sorry to spring it on you.
So I think that the point, the really important point in there is, one is the transportation, but the other one is, can we identify people who are more likely not to show up? Because that's the thing that really impacts on our list. That's the point, isn't it? And by the clever use of AI and other techniques, they're able to say these are the people that may happen to. And I think you talked to me, didn't, about it's not just about they can't get there. It might also be that they're worried or they're scared of whatever. And actually using that technique and the data to actually analyse and actually reach out to those patients in advance of their operations to make sure they're comfortable. And I don't know, I mean, you probably haven't got an answer specifically to that, but it seems like one of those things where you think, do you know what? That's probably where we're going to have a chat with that organisation.
Yeah, no, absolutely, and I've read the same article, so I know what you're referring to. We're doing a piece of work with South Central Ambulance, who manage the patient transport into hospitals at the moment, and I'm on the steering group to look at how we maximise that capacity. And the biggest thing that affects that capacity is when people aren't ready and able to come in. And I don't mean ready as in we've got their bags packed. I mean mentally ready for the appointment. They've got everything set up for the appointment. So we're very engaged in that conversation with South Central Ambulance at the moment. We haven't done anything around AI from the point of view of trying to identify the groups, but we do contact patients who don't attend their appointments to find out why they haven't attended and to try to learn from it. And one of the most simple things the team have been doing, and I will single out Claire's team have been doing, is actually phoning patients ahead of their appointments to make sure that actually they've remembered they've got an appointment, because we're all human, and actually everything's in place for them to attend their appointment. Because from a resource point of view, there's nothing worse than us having wasted resource because the patient hasn't arrived, and nothing worse for the patient that they're going to have to wait again for us to bring them in. So not quite there on the AI, but we are looking at how we can make it better. But it was an interesting article, wasn't it?
Thank you. Any final comment or question? We've got one online, haven't we? So let's take the one online and then we'll wrap up.
Yeah, so we've got, how is the Trust prioritising its resources now in reducing the maintenance backlog on its estates, considering the current financial situation?
Oh, that's got to be a Chief Financial Officer answer, hasn't it?
So, I mean, I think it's a very good question. The answer is quite challenging because not only have we got an issue around the funding that we've got to run our operations, also we are capped on the amount of capital that we can spend. And actually the amount of capital allocation that we get given isn't really enough to make any impact on the backlog. So we're constantly trying to look at how we reduce the risk along the backlog that we've got, but recognising that the situation actually is not going to get any better. In fact, it's probably going to get worse. And you might expect that if in 10 years' time we would expect to have a new hospital. You wouldn't want to have a perfectly operational, everything absolutely new and working really well in the hospital you're leaving behind. So that's really the challenge. We prioritise based upon where we see the greatest risk, but truthfully that risk is over time going to increase because we are constrained both on capital and on revenue.
Yeah, it's a good point. And I think when you get into that position where you draw the line on the priorities and there's still stuff under that line, it's really, really important. That's hard stuff to do. So, and I know the teams work really, really hard about maximising the use of resource. So sometimes you can do 3 or 4 things at the same time, can't you? But it's a big challenge for this trust, our estate and our infrastructure, and it always will be until we get to that new hospital programme. Okay, happy for me to conclude? Right then, so just a few final reflections from me. So I I think we've given you some really strong highlights of some of the work we've done. There are millions of other things that we do every single day, that our staff do every single day, that are brilliantly positive. But we know that there are areas where we aspire to do much, much better. We hear what patients say sometimes, and they're not good outcomes. We understand what it's like if you go into our emergency department and we're not able to process and flow people properly. We know we've got people in our hospitals who shouldn't be here, and every single day they're here and they don't need to be, their health is suffering. We know those things are happening, but we do loads of good stuff as well. And the one thing I can absolutely tell you as chair of this organisation is that our people work hard, they're compassionate, they're committed, and they're dedicated, and they don't stop trying ever to do the right thing for our patients. And if it was anything other than that, then I wouldn't stay here in this organisation. And that's testament to everybody. It's testament to the board, our executive colleagues who are here, the non-exec colleagues, our governor colleagues, our volunteers, but mainly it's testament to our staff because they never stop trying to do the right thing. I was going to say something about the NHS being broken now, Brian, but you spoilt that line. It actually made it better, taking it earlier on. And I just want to say thank you to all of the people who work here, because not only are you a credit to yourselves, you're a credit to the trust as well. Now, Dawn alluded to the fact that I might not be here much longer. About 3 months, I think. You'll have to put up with me. So this is my last AGM, and I thought I'd just say a few words about some of the stuff that's happened in my time at HHFT. So COVID happened. I didn't expect that to happen, but it sort of turned up on our doorstep, didn't it? And I just mentioned COVID because it was an example of when our people were at their absolute best. When we didn't, can you imagine a position where we had a worldwide infection that nobody knew anything about, nobody knew how to fix, everyone was really scared, and our staff were dealing with patients in a situation which was horrific for lots and lots of people. And those same people are worrying about their own families at home. Can you imagine what that was like for those people? Over a really extended period, that was really hard for this organisation. And I think our people were, right across the NHS, not just in this trust, did such a fantastic job of how we managed that, how we supported families through that, at the same time as those people worrying about their families. Every year, a whole load of stuff changes. Governor meetings went online, didn't they? The board meetings went online. And that was such a testing period for this organisation. And now it's like catching a cold, isn't it? But let's never forget the sacrifice that people made during that time. It was huge. We've had the formal introduction of the ICB infrastructure. That's quite a big change to the way we operate as health services and how we have a responsibility to collaborate with our partners. And, of course, we've got the new hospital programme, and that's progressed. Not quite as fast as I thought. I might be digging the first footing, but that's not quite going to happen, is it? A couple of other examples. We put the new heart centre in, the hospices went in, we put the new pharmacy in, virtual wards, the ACDC. I'm not going to make a rock music joke ever again about that. We've started the elective hub, the orthopaedic outpatients department. But the other side, the other softer side of all of this, the stuff that's happened, is I think we've changed the culture of this organisation. I think we've moved our leadership capability on. Loads more to do, Tim. I'm going to come back and haunt you around that. We can do that so much better, but it feels like the kind of place where we're moving it in the right direction in terms of culture and leadership. And the people I meet, it's always a positive conversation that we have, despite all the pressures that they face. And of course, in that time, we've had 5 prime ministers and 7 health and social care secretaries, although one of them was twice. So, I said in 2019, actually, my first AGM, that it felt like an organisation that I'd known for many years because of how welcoming it is. And actually, when I asked people who joined this organisation new, and they've been here for a few months, I say, what does it feel like to work here? I'm really interested in how we've welcomed you. And everybody says the same thing. This is a good place to work. This is a supportive place to work. People are very kind. And it still feels like that to me now. 5.5 years, how can it be that long? And the thing I would say as chair, it's been an honour and a privilege, and I really mean that, and some of you have heard me say that before. It is an honour and a privilege to work in the NHS, and it's an honour and a privilege to contribute to support our people in doing the jobs that they do. So I just want to finish by saying thank you to Trust Board, the execs and non-execs, because without the board of this trust, trust me, we wouldn't be in the place that we're in now. To our Council of Governors for the fantastic job that they've done. but mainly to our staff, because I know our patients are in safe hands now, and they always will be. I just want to say a few thank yous specifically around tonight. So thank you to the marketplace teams that were in the stands outside. So that was research and development, patient experience, sustainability, recruitment, HHFT charity, the governors that were manning the stand up there, and of course the modernising our hospital services at the Mohs team. I think this has been one of the best AGMs that's been organised, probably by this trust. It's certainly better than other organisations I've been to. The comms team, I was going to try and read all the names out, but actually it's the entire comms team led by Andrea and the corporate executive team led by Owen. What a brilliant job you've done of organising this AGM. And I tell you, that video worked really, from my perspective. I can say what I like now, because I'm leaving anyway. So I thought the video was great, and I think the whole way you've done it. And the reason the video is really, really good is if you're watching it virtually, it feels like you're in the room, isn't it? You're not always in that standoff. So well done. It was a brilliant job you did. The mini cakes that I note disappeared quite quickly. They were provided by the ARC. So thank you to the ARC for providing that. So good use of resources, Steve. Thank you. And for those of you who didn't manage to get in the ARC car park, who were parked in the public car park, you should be able to get out without paying any payments. So just drive up to the barrier, buzz, and I'm assured that somebody will let you out of the car park and you won't have to. So please don't, if you've come to the AGM today, please don't try and pay to park, all right? It was free and you should be able to get out if you buzz. Final slide now, and this is all about feedback. So there's a QR code for those of you who know all about QR codes. We will be sending a survey out for those of you who can't use QR codes. But if there's any feedback you want to give us about how we can improve the way we do the AGMs, if there's any questions you want to ask, you haven't had the opportunity, or any observations you want to make, we always want to hear from you. We always want to hear from patients. We always want to hear from our communities. So thank you very much for coming this evening. I hope you've enjoyed it, and have a safe journey home. They're going